Hello, my name is Gwen. I'm the owner and coach at Get Fit with Gwen. I've been working in the fitness industry for over 20 years, most recently working for the past 10 years in bariatric clinics here in North Carolina. I am looking forward to helping you reach your fitness goals and add this very important tool to your toolbox to help you reach all your goals. All right, so thank you for entrusting me with your fitness needs. Today we're going to talk about a few things to help you get started. First off, I want to go over the basics. What is exercise? Exercise is structured activity where you are deliberately moving your body over time to achieve a certain goal. It can look like cardio, it can look like strength training, it can look like yoga and stretching, walking. There's a lot of different modes of exercise. But today we're going to talk about two main modes of exercise. Cardiovascular exercise, like walking or riding a recumbent bike or dancing, and strength training or resistance training, where you're working against something like an exercise band or using hand weights or a kettlebell, or maybe even your body weight. These are all important types of exercise. We're going to focus on the cardio and the resistance training. Many patients ask me what they need to purchase to get started. And typically my answer is to start with what you have and start where you are. So if you have a gym membership, great. If you don't, that's okay too. If you have at home some dumbbells or hand weights that are 5 pounds, 2 pounds, that's perfect. You can get started with those. You might even have a stretchy band or a resistance band at home from physical therapy. That's where a lot of folks get these bands from. Dig them out because that's a great tool to use to get started as well. And maybe a chair. Sometimes folks need to modify exercise to get started, and having a sturdy chair with no arms can be helpful to have in your exercise space at home. But you definitely can exercise at home in your living room without having to join a gym. And I can help you get started with that. All right. So what is the role of exercise for surgical weight loss patients? It certainly plays an important role. And before surgery, and maybe 1 to 12 months after surgery or a year after surgery, you're going to make sure you're exercising, and I'll explain how much and what kinds later, but exercise is important before surgery in order to maintain muscle mass. So when I'm talking about muscle mass, I'm talking about lean muscle tissue or the muscle tone that you see in the biceps or in the triceps muscles, right? So we want to maintain those skeletal muscles as you're losing weight instead of losing those muscles. And so that is the main reason to do strength training or resistance training before surgery, is to keep your muscles, right? Because during weight loss, our bodies do break down tissue in our bodies for energy. We want it to break down fat mostly, right? We want to burn more fat, in other words. But it will sometimes break down muscle tissue because it's looking for extra sources of energy and protein while you're in a calorie deficit. Doing strength training literally tells your body to keep your muscle and burn more fat. So to me, that's a big reason why to do strength training before surgery and once you're cleared after surgery on an ongoing basis as you continue to lose weight. This is especially important for surgical weight loss patients because you will lose weight rapidly after surgery. And the more rapidly you lose weight, the increased chance you have of losing that skeletal muscle. All right, what about after surgery and onward? So once you've reached your weight loss goal, it's still important to incorporate that strength training piece and cardio. Can't forget about that part as well. So you'll be doing exercise in general for the rest of your life after surgery. That's what we recommend because exercise has been shown in research to be a key factor in helping surgical patients keep the weight off long term, years out from surgery. So exercise is important for weight maintenance after surgery. It's also important because a lot of my clients and patients in the past have shared that they felt like they've gotten weaker after surgery. So implementing strength training and regular exercise can help increase your strength again and regain muscle mass after weight loss. All right. Exercise also has so many other benefits though. So you may have already experienced some of these, but most of my, over my years and years of working with patients and clients, I've heard feedback that exercise can increase their energy and help them manage their mental health or stress better, help them feel better in general. They feel stronger and more confident in their bodies. And all those things, plus the numerous health benefits of decreased blood pressure, better blood sugar management, better cholesterol, all these things can really make exercise a super useful tool in your toolbox. All right. So let's move on to some guidelines for exercise. General guidelines for bariatric surgery patients in terms of how much exercise and what type and when. So first, it's important to know that, as I said in the past couple minutes here, that exercise is really important for you in your journey. It's an important tool to add to your toolbox. Very powerful. So overall, getting started with exercise and keeping it going long term is going to be important. But more specifically, pre-op, what I typically recommend is for you to work up to about 30 minutes of exercise 5 days a week. That equates to 150 minutes of exercise a week. It sounds like a lot to start if you aren't doing any exercise, but that's okay because we want you to start with less than that and progressively work up, increasing your time over a period of months. Okay, so for example, most of my patients start out with a goal of walking 2 to 3 times a week in 10 to 15 minute bouts at a low intensity. That's important to remember too, because a lot of folks will start out really gung-ho and go really far and really fast and feel like that's going to really get them going. But it's important to go slow and low at first and gradually progress up, right? Because that helps you, number one, prevent extreme muscle soreness, aches and pains, cramping, things that are very unpleasant. And number two, you have time, right? So there's no rush. You can gradually increase time, you can gradually increase intensity as you become more fit, and it's easier to do it that way, okay? So 30 minutes a day, but working up to 30 minutes to 5 days a week. So overall, 150 minutes of moderately intense cardio over a week spread out. Okay, next, you're going to want to incorporate that resistance training like I talked about. So resistance training using exercise bands, using dumbbells, body weight exercises. Those are great ways to exercise your muscles, those skeletal muscles that we talked about earlier. And you want to do that 2 to 3 times a week indefinitely, right? So this is before surgery. But really that goal is the same the whole way through, except for a break, of course, after surgery while you're recovering. So that strength training piece, you want to do 2 to 3 days a week. And it's important to note that you want to give yourself 2 to 3 days break between sessions. All right. So the reason you want to do that is it gives your body time to recover and repair the muscles that you stressed out and overloaded in your strength training or resistance training workout. So what happens when you're strength training is you're working those muscles and creating actually tiny little tears in the muscle fibers. Your body responds to that stress by getting stronger and building more muscle, which is awesome. Muscle is a great metabolically active tissue, right? So we want more muscle. But in order for your body to do that work, it needs time to rest and recover. And that happens within 24 to 48 hours after a strength training workout. So make sure you have those breaks between. Okay? Now, let's talk about after surgery. So after surgery, you will want to wait till you have clearance, first of all, from your doctor, surgeon, PA, before you begin or resume exercise, right? So make sure you're rested, recovered, healed well enough, and get that clearance before you start back with exercise. But the guidelines are going to look very similar to when you're first starting out. So like now, you will start low and slow, and you will use light weights or maybe no weight at all, and gradually increase the time, intensity, frequency of your workouts over a period of months, working back up to 150 minutes of moderately intense cardio each week. And that can be spread out over days. So, for example, 5 days a week, 30-minute bouts. Now, with cardio, as you gradually increase your time, and if you get to where you feel like a moderate intensity at 30 minutes is pretty doable, then you can increase your intensity as well if you like. But you don't have to increase time past that 30 minutes for the majority of that immediate time after surgery. We don't want you exercising too much because you're going to be on a restricted calorie intake, and we don't need to create more deficit with exercise. Okay? It's there to help you. All right? And the strength training after surgery is the same guidelines, but of course, waiting for clearance from your doctor. Then you can resume using light weights, slow and low, and gradually increase over time. But it's 2 to 3 times a week, hitting most major muscles each time. Okay? As I will say, and you'll see these in my videos, but if anything causes you pain or discomfort, any of these recommendations don't feel right for you, let me know and let's talk about it. All right. There's definitely ways to modify and adjust and adapt these goals. They're general guidelines for most people, okay? All right, so as you get closer to your goal weight, so that's different for everybody in terms of when that happens, but let's say it happens about a year out from surgery, or maybe 8 to 12 months from surgery. So once you got to your goal weight, then you're going to want to move into a maintenance exercise plan. Maintenance exercise looks a little different than when you're in active weight loss. So as you're losing weight, we generally keep that exercise kind of moderate, not too much, but getting that strength training and cardio in regularly. Now that you're entering maintenance, to keep the weight off long term, you definitely want to increase the time, working up to, again, progressively, maybe in 10-minute increments, working up to an hour most days of the week. Okay, now that's still at moderate intensity, and that still also includes 2 days of strength training or 3 days of strength training. And sometimes at this point, you'll be able to combine strength training and the cardio pieces together for one workout. And if you've already been working at a higher intensity at this point, at maintenance, you can then decrease your time. So time and intensity are interchangeable, which is a great thing. So if you're short on time and an hour seems like a lot, then once your intensity is high enough, you can do half the amount of time at a higher intensity for the same benefits. Isn't that great news? And of course, high intensity is different for everybody. All right. As always, though, do what's appropriate for you and your body, listening to your body. And keep in mind, high intensity interval training is not for everybody, and you certainly don't have to do it to get the most benefit out of exercise. That's all I have for you. I'm going to wrap up here with just a couple of quick, frequently asked questions that I usually get from clients after talking with them about this information. And then we'll be done. So first is, will exercise help reduce loose skin after surgery? And this is a great question. Definitely understand the concern there. And I certainly encourage you to talk with your doctor about this question as well. They can be very helpful reviewing this information too. But from an exercise standpoint, I will share that the short answer is no. Sadly, it does not increase the elasticity of your skin. However, I might offer that strength training or building up the muscle underneath the skin can help us feel better in our bodies. It does improve your self-esteem when you do that regular resistance training. And you might see more muscle tone under the skin if you're doing the strength training. So my other frequently asked question is, how do I tighten or firm up my abdomen? How do I burn more fat in my stomach area? Is that possible with exercise? And this may be already known by most folks at this point, but unfortunately spot reduction, which is what that's called, doesn't really work. So you can't exercise your abdominal muscles to burn more fat in your abdominal area, unfortunately. So the answer is no. But again, if you're strengthening those muscles, building those muscles underneath as you lose weight, there are many benefits to strength training in terms of burning more fat, helping increase muscle tone, and again, feeling better in your body overall and building that confidence. All right, so what's next is you'll see me one-on-one for an online meeting, and we'll talk about your specific goals, and we can review any of the information you saw today in the video. Feel free to rewatch this video if you'd like. Take notes, jot down any questions, and bring them to me when we meet one-on-one, where we'll set your goal. You'll also have access to, and you already have access to, several examples of workout videos that I created just for you guys. So I hope you enjoy them, and hopefully they're helpful. And I look forward to meeting you in person soon. Reach out to me with any questions. Bye.